Welcome, everybody. If you have not been to Trauma Training Tuesday before, we are thrilled to welcome you to this one because it's going to be bombshell because Nikki Bell is the bomb. This is Nikki's fourth time doing Trauma Training Tuesday. She did, I'm going to have other people here. And Kelsey, you have mute power, right? Thank you. We started doing Trauma Training Tuesday like live and in person in 2019, and Nikki was one of our first presenters live and in person. And then we went to Zoom in 2020. And Nikki really, Nikki, I probably have told you this a million times, but you are a big part of why we do this and why this exists. My thing that what I know from school and theory and academics falls really, really short when lived experience isn't part of the equation, isn't part of what we know. I said in the promo material, I really bought the sort of public narrative about prostitution and who is harmed and what it is. And it was because of you that I learned that is a convenient lie that we tell ourselves about what's happening for people. And so I don't want to take too much time in introduction. I'm going to just turn it on over to you. If everyone could mute themselves, if you're not Nikki, that would be awesome. I know people will ask, we are recording this. We will post the recording as soon as it comes back from Zoom on our website. Nikki, we didn't talk about like what do you want questions as you go? Do you want them held to the end? How would you like to approach it?
Yeah, feel free to ask questions as we go. And then I'll save some time at the end for additional questions for folks or comments.
Beautiful. All right, I'm going to mute myself and turn it on over to you. Thank you so much.
Thank you, Amy, and thank you everybody for being here. Today we're going to talk, and it's conveniently timed apparently, with a presentation that I call When Helpers Hurt. So I'll give you a little bit of background about me. Except I don't know how to change the slide, so hold on a second. Oh, there we go. Now it's changing.
It has changed. You got it. Good job.
So I always introduce myself and give a little background. So my name is Nikki Bell. First and foremost, I'm a survivor of multiple forms of gender-based violence, including prostitution, trafficking, intimate partner violence, domestic violence, and state-sanctioned violence. I also am a person in long-term recovery, which for me means I haven't used drugs and alcohol in over a year. And so I got out of the life in about 2014. And, there was a lot of work at the time going on in the city to address the issue of prostitution and exploitation. And so I was invited to sit at these tables with this multidisciplinary group. It was called the Worcester Alliance Against Sexual Exploitation. And we were looking for solutions to address prostitution that no longer involved just incarcerating the survivor. We're putting it through a demand reduction framework. So essentially, my pimp wouldn't have sold me if there was nobody to buy me, right? And so started addressing demand rather than incarcerating the survivor. And I was at those tables and we were able to do some really great work under, imagine this, Chief Gem. We did great work under Chief Gem, which everybody's always like, what? Anyways, and we were able to stop arresting survivors, and I was able to be at the police station when they came in, and we would offer them treatment rather than arrest. And some of the women chose to go through the criminal arrest process because they know that they'd be bailed out in a half hour, but most of them treatment and they were going to stop substance use and exit prostitution and live a beautiful life with a white picket fence and 2.4 kids, right? The point was we were making we were building a relationship with those women that nobody had a relationship with. And so we did this Worcester needs assessment, and we really found that one of the greatest issues we needed to address within the sex trade is that substance use and co-occurring mental health disorders. There was nowhere for folks like me to go. And, you know, I'm going to be honest with you, when I was thinking about this training, so I was sober for 9 years previously, and then I relapsed. It's now been about a year and a half. But so I'm going into these treatment programs and I'm thinking, wow, it's going to be different this time, right? And it was exactly the same as it was a decade ago. And that was so incredibly disappointing to me because we need systemic change. And I'm going to talk about those policies within treatment programs that are harmful to people. And so how do we do this work knowing that trauma and substance use overlap, right? And not do it from a trauma-informed framework. And so that's what we're going to talk about today. But I opened a substance use program called Jana's Place, and we ended up opening a shelter and doing all kinds of great work until I relapsed, like I said, a year and a half ago. I'm now back doing advocacy work with Latin American Health Alliance and also still doing advocacy work on behalf of survivors. I consult with OVC, the DOJ, Equitas, the International Association of Chiefs of Police. It's funny because I came out about the police department, but then I go and train police other places. But for some reason, our police won't believe me. So we're going to move along. So anyhow, I wanted to talk initially about the intersection of trauma and substance use disorder because our programs, like I mentioned, can somebody monitor just the chat for me? Is that?
We're working on it.
Okay, cool. So trauma increases vulnerability to substance use disorder. So people who have experienced trauma such as abuse, neglect, violence, or ACEs are significantly more likely to develop substance use disorders. Trauma can alter brain chemistry and functioning, leading individuals to use substances as a way to cope with emotional pain and dysregulation. I will tell you, in my last relapse, I'll talk about my most recent relapse just because it's more time appropriate. I was so incredibly dysregulated. My family actually had to go to court and try to section me, which is also super traumatic, and I don't advise doing it. But I was so incredibly dysregulated, and I couldn't function without substances in my body. And so I was constantly my trauma was sitting right here in every treatment program I went into. They gave me no skills or tools to address it. And so what would I do? I would leave and go use substances again. And so it creates this vicious cycle of needing substances to manage your trauma and then creating more trauma while you're trying to get substances. And so it becomes a really vicious cycle. And then substance use can exacerbate trauma symptoms. So substances can initially offer temporary relief, from anxiety, flashbacks, hypervigilance. Long-term use often worsen these symptoms. They create a vicious cycle of self-medication, increased dependence, and worsening mental health. And I found that to be true, for myself when I was using, I relapsed on crack cocaine was what I relapsed on. And, the reality is the PTSD, the anxiety, the hypervigilance actually increased for me. So it was really what I was doing was creating a lot of harm for myself, but I didn't know a way out. And then shared neurological pathways. So both trauma and substance use affect the brain stress response system, including the amygdala, prefrontal cortex, and reward pathways. Trauma can lead to chronic stress and heightened cortisol levels, while substance use can dysregulate these systems further, making recovery even more challenging. So, I just like to help people understand the intersection. And again, I'm super confused why at this point we aren't treating we aren't having trauma-informed, or I'm not even gonna say trauma-informed, I'm gonna say trauma-responsive programs at this point. And then high occurrence with PTSD. So post-traumatic stress disorder is highly prevalent among individuals with substance use disorder. Studies show that around 30 to 60% of people with substance use disorder also meet the criteria for PTSD, highlighting the need for integrated treatment approaches. And we know that integrated treatment improves outcomes. So trauma-informed care and integrated treatment approaches that address both trauma and substance use simultaneously are far more effective than treating each issue separately. Approaches such as EMDR, which I swear by, it changed my life, cognitive behavioral therapy, and harm reduction strategies are key components of holistic care. So really ensuring that within our programs, you know, because I go into a program and I tell them, you know, I couldn't manage being in a room with anybody else. I couldn't sleep. My trauma was so elevated and I didn't have those substances anymore to help me regulate. And so they would essentially tell me that, you know, we'll deal with the trauma later. And it's like, that is not a solution. We cannot separate these issues. They are so interconnected. And so how do we create programming that responds to both trauma and substance use and mental health? We silo things incredibly. You know, it's like, get your mental health treatment here, get your substance use treatment here, get your trauma treatment elsewhere. And now we're talking about people that have limited means, are not able to access transportation, and we're making it incredibly hard for them to receive the treatment that they need. So I'm going to talk a little bit about traumatizing treatment. These are some, I pulled out a few highlights just to kind of give examples of what I was talking about. So, I also want to say, before I go on, that Hector Reyes House is really doing some incredible work, bringing all of those options in. So I don't know if you know this, but they have a medical provider that comes on site and treats all of the men. They have a clinician, a licensed mental health clinician. They bring in psych treatment to the program. And so I just really want to shout out, like, there are programs that are doing this well. And I know they're always happy to talk with folks about their model and how that works. It's really a medical model, and they're treating the substance use disorder as a medical condition, which it is. So rigid rules and policies, for example, zero tolerance for relapse. So a lot of programs, if you relapse within them, their first thought is to discharge you. So you're relapsing with a chronic health condition, right? Nowhere else do we say, you know, if you're getting treated for diabetes and you eat too much cake, we don't say, get out, we're not helping you anymore, right? And these are not, I'm just not talking just about zero tolerance for relapse. Does anybody, I can't really see anybody, so I don't know, I'm gonna pull this up. Does anybody work in treatment at all?
Yeah, lots of people here do
Yeah.
treat.
I worked with you.
Oh, there we go. So I want to talk about some of those rigid rules and policies that can exist during treatment. And I just thought if people worked in treatment, I'm sure they could name a few, but I'm happy to do it too. So other things that we do, we take people's cell phones, right? Because we don't want them to call their drug dealer. But what we're also doing is removing their ability to access their supports, right? We should be mapping with people and figuring out where the gaps are in their connection to our community and how we can help them get rooted in community. So doing things like taking people's cell phones, not allowing them to see their families are actually harmful, not helpful, right? Very strict curfews. Yes, it does need to be addressed in treatment. You're correct. Eating disorders need to be addressed with all substance use. Absolutely. So some of the rigid rules that I'm referring to is for example, when you're getting a talk screen, they put the person in the bathroom with you and watch you, which is super invasive for survivors of any kind of violence. And what does it also say to people? It says that we don't trust them, right? And we don't believe they're really here working on their recovery. And so I've done a lot of work with Dr. Mishka Turplin and Davida Schiff, and they've really moved away, and Dr. Callahan, and they've really moved away from surveillance drug testing because it's actually not helpful, it's harmful. You will know when someone has relapsed within your program, and you know, they may already have a way to beat the urine ahead of you screening them. So, you know, we can do away with those types of policies that are really invasive and harmful. I'll give another example. When I won't name the treatment program, but I went in for a treatment program, and they actually told me that the only way I could stay is if I went to the hospital and had a cavity check, because they believed I had drugs on my person. And so at that point, I really wanted treatment so bad. I was like, whatever, I'll do anything that you need me to. But to actually make somebody go to the hospital and endure a cavity search to access treatment is really not helpful. So now I'm traumatized from that experience. Of course, my trauma is sitting right here, and we're not going to address it. So rigid rules and policies actually further traumatize people. And then power imbalances between staff and participants. So there's one of the things that we did when we were at Jana's place, when we were designing the program, is we actually made it so there was like not an office space initially, because we didn't want the staff sitting behind a door, right? And the participants having that power over, like Amy just mentioned, trauma is about power over, right? And so within the recovery community, there is a really unhealthy balance of telling people that they don't know what they need. They need to be guided by somebody else. They can't make any decisions. And so we start looking to staff members to manage every part of our life, when the reality is we should be helping people stand in their power and figure out how to navigate all of the challenges that they're facing. So there's incredible power imbalances between staff and participants in substance use programs. Yeah. And how are you supposed to build trust in yourself or others in that scenario? Right. And building trust is a huge part of healing. You're correct. So lack of cultural humility or representation in staff. This is huge. And again, you know, shout out to Hector Reyes House, who I guess I'm going to keep using as an example. But really hiring the community that you're supporting, right? And so I don't know if you know this, but most programs don't have any Spanish speaking programming or programming in any other language. And so when folks don't have access to interpretation services, they're forced to sit in these groups all day and they don't even understand what's going on. And that is no fault of their own. We should be providing language access, right? That is the responsibility of the provider. And so making sure we have staff that look like them, that come from their community, that speak their language is so incredibly important. Oh, I heard that one. And then punitive practices like loss of housing for non-compliance. So, you know, the reality is how you heal from trauma is by having these small gains, right? You made these small gains, celebrating those small gains until you make larger gains, and then celebrating the hell out of those, right? So telling everybody what they do wrong all the time and punishing them is actually not trauma responsive at all. It's the opposite, right? We should be again, sharing and championing the decisions, positive decisions that they make. We're all going to make mistakes. We're all going to be late. And when I say punitive practices, like we take people's housing because they can't stay sober. And I'm not going to say can't, they aren't able to stay sober right now, right? And so how do you think making them homeless like interferes with their substance use. Do we think that's beneficial? Because it's not. And then also in these programs, there's a lot of stigma against medicated assisted treatment. I am a huge advocate for medicated assisted treatment. It is the gold standard for treating substance use disorder. And MAT is often misunderstood as substituting one addiction for another. There's lack of awareness about its effectiveness, which contributes to stigma. So when I first got out of life, was taking a medication called Suboxone. And did you know my doctor never explained to me how it worked or the receptors that it worked on in my brain? So I was just blindly taking this medication. And then I was doing a series of training at the fire department. And Dr. Castile gave a presentation. And for the first time, I actually understood why I was taking the meds that I was taking, right? But we often, and that's in medical care in general, right? You get 15 minutes where we don't have time to address all of those things. We're pushing people through. But I didn't even understand the effectiveness and why I was taking it. Social and systemic biases deter individuals from seeking medicated assisted treatment. And then judgment from peers, families, and even professionals create barriers. Agreed. And then I'm going to talk a little bit about the dangers of 12-step programs. So right now, if I was to enter a program, 90% of them are 12-step models, right? And 12-step models, it's great. They work for some people. I'm not saying that they don't, but the reality is the rates of relapse within programming is really high. The powerlessness language feels disempowering. You know, I remember I was sitting in a treatment program up in Maine, and they were forcing me to do the first 3 steps or first 4 steps. And for me, it was like, I didn't need to right size my ego and feel powerless. I felt powerless all my life. I needed to stand in my power, right? And so this language can feel really disempowering. And then, you know, they want you to share past experiences. So you're also sharing past experiences with people that aren't trained clinicians, they're peers, right? And so when you trigger your past trauma, there's nobody to help you pack that back up, right? And so it's really dangerous to be asking people to go back through their life and identify every trigger. Also, the idea that you need to take responsibility for your substance use disorder. It's actually offensive because everything you have to go through and like, okay, my part was I used substances, so I was sexually assaulted in prostitution. So it shouldn't matter. I don't need to take ownership for trauma that happened to me, right? And so we shouldn't be forcing people to. Every part of it is look at your part in that. And so you have to identify the mistakes you made that led you there to have that traumatic event. That can be catastrophic. Lack of cultural inclusivity and representation. So it was a program that was designed by old white men for old white men. And we have not modified that in any way. And so as women, it can feel really offensive. I mean, even the 12-step, the big book, it's like they have one chapter about women, and it's actually called The Alcoholic's Wife, right? So it really was about how alcoholism affected their relationship. You know, it was not focused on providing solutions for women. And so we really, like, this is an outdated model. There's a lot of data that shows it doesn't work and it's harmful. The emphasis on spiritual surrender may alienate non-religious participants. So you're forced to identify a higher power. And then the peer-led structure definitely lacks trauma-informed facilitation. That's the reality of it. Does anybody have any questions so far? Comments?
Lots of people are really resonating with everything you've said so far. So most of the comments are like right on, exactly. And yeah, I did not know that about the big book, and I'm embarrassed I did not know that, but that is disgusting, honestly.
Yeah. Yeah,
Wow.
we do a lot of really disgusting things in treatment to people. And oh, Susan
Susan's
has
got it.
her hand raised. Great.
Go, Susan.
Sorry, it took me a minute. Hi, Nikki. I always am on the edge of my seat when I hear you speak. Thank you for being here. My question kind of popped up into my head when you talked about, so I'm a big advocate of peer-led programs. I think they have an amazing possibility. But I think on your previous slide, you talked about maybe a deficit of peer training in terms of being trauma informed. Did I understand that correctly?
Yes, especially in the 12-step communities.
Oh, okay. All right. Because one of the things I ran into, and I'm just wondering if this is true about peer supports that you've seen, is that one of the downsides of using peers, and I think peers should definitely be used, but is that if they don't have proper training, they may just say, hey, I did it this way, do it this way. This worked for me. Or they've never actually dealt with their own trauma.
Right.
And they're triggered every time they hear something. I just wanted, because you mentioned about the peers.
Yeah, I mean, I think that's a significant issue. And, you know, the 12-step model is very much like you follow the direction of others and how they did it. And oftentimes trauma isn't addressed at all. And also, like you talked about, a lot of peers, they haven't worked on their trauma, so they may be sober, right? And can give some guidance in that area, but have never addressed the trauma that they've experienced. And so I think peers are incredibly important in a trauma-informed programming. But the reality is we don't provide enough training and support to advocates in the field. Trauma is kind of looked after, and you experience a lot of trauma when you're working in the field. I don't know if any of you have ever had to respond to an overdose, but it's incredibly traumatizing, right? And you have to after just go back to doing your job, right? So we don't even offer support for people that have experienced witnessing an overdose or death in the house, right? Because they happen, and anybody that tells you that they don't happen in their program is not telling you the truth. Substance use disorder is chronic and relapsing, and so people use substances in programs. And often support is not offered. So I also led low barrier access shelter, right? And I will tell you, we had a lot of overdoses. And to me, that was a signal that what we were doing was working, right? Because we weren't throwing people out when they used, right? So we didn't Narcan them and wake them up and say, you have to get out, right? We were able to intervene in that moment, call 911, get them the help that they needed, and they were welcome back, right? So the reality is when we use substances, people are going to relapse and people need more support. And it's funny because it's often the peers that are working in the community that like, oh, she's got to go. Like, we're not doing this. She's not ready. I can't tell you how many times I've heard she's not ready. And it's like, I was always ready. I was ready for treatment, but there were so many barriers in front of me that I couldn't access it. And so I was unable to access treatment. And I think that language is really important that we're using, like they're not able to, and not they don't want to, or they can't, or they won't. They're not able to in that moment.
It's true. It's true. I was in that way too. I was an addict, and I was in the program for almost 14 years. I used to get methadone. I was all the way up high, but 95 milligrams. And I used to do my groups. I used to do my counseling. You know, sometimes I was clean, sometimes I wasn't. But the counselor, instead of telling me you're out, they used to talk to me and used to help me like bring my dose a little bit up, you know, a little bit here and there, you know, and kept on going to my groups and kept on going to my counseling sessions. And after a while that I kept on talking to him, you know, and going to my listening to all the stories that other people had in the group, that helped me a lot,
Yeah.
you know. And I started to thinking, oh, if I stopped using, but I was still in the methadone. Um, I started saying to myself, after I hear so many stories, I started saying to myself, what am I doing here if I'm not using? Why am I taking the methadone if I'm not using? So I told my counselor I want to try to go down. So I started going every 2 milligrams every 2 weeks. Bring me down 2 milligrams till I got to 15. And it's like you said, I was afraid of what am I gonna do now? I stopped at 15. I said, what am I gonna do now? I was afraid that my body was gonna get sick. And I said, God, what am I gonna do? Should I go to the Suboxones? Should I stay here? You know, and it's something that you have to think because you don't want to see yourself out there. You know, I was never out there because my boyfriend and I we were both using, you know, and he was the one that used to go out there, you know, but I said, I don't want to do this no more. And I said, God, with you, I'm gonna go all the way down. They took me a lot because I was so afraid. And I said, the higher power is what's gonna help me. So I said, let's keep on. And I kept going one every 2 weeks, one every 2 weeks. December 26, 2018, they said, this is your last drop. I went to my doctor and I explained to him what I was doing. And he gave me medication for the withdrawals, you know, to calm me down in the withdrawals. And since 2018 till today, I've been clean.
Good for you.
I've been clean and I
Congratulations.
feel proud of what I did. And I go to church, I go to, you know, to my higher power. I speak to people about what I did. I feel proud of what I did, you know, and it's a different life. It's a different life, you know, and my kids are proud of what I did too, you know.
Yeah, and I think that's something that, you know, we don't talk about enough. It's funny because every time I meet someone that is on medicated assisted treatment or Suboxone or methadone, they say, I'm on methadone, but I'm coming off, but my dose is only this. But, and I always say to
It's
them, I
always the
said,
but.
full stop. You don't have to have a but, right? You're taking a
Right,
medication to treat your substance use disorder.
right.
I'm not judging you in any
No,
capacity. Suboxone saved my life when I finally started using it appropriately.
right.
And so everybody's pathway is different. And I like how you mentioned you use medication, you use the counseling and support, you used a spiritual connection. So you had a really actually comprehensive recovery plan, right?
Yes,
And showing that instead of kicking you out, right, they provided support for you. That is what
yes,
we need to do for everybody.
yes,
And even now, like somebody mentioned harm reduction, and I think harm reduction is even really misunderstood. So the only thing we value is abstinence. And so if people are on medication, we judge their recovery as they're not really in
yeah,
recovery. If people and so we want them to move towards a goal of abstinence. I always say
right,
people are valuable as they are, full
right,
stop, right? Whether
right,
they're using substances, whether they're not, whether they're
right.
trying to get off, whether they're trying to get their next one, right?
Yeah,
And so we need to start looking at individuals and providing them with the resources that they need in
yes,
that moment.
yes.
And then see, Uhai for Health has her hand raised as well.
Yep, Jane has her hand up.
Hi. Coming from the African community where we have a lot of stigma to mental health and substance use and misuse, I find, and also as a substance abuse counselor, I find like we have the two models. In the African community, there is so much the moral model whereby it's people use substances, it's evil, they are morally wrong, they're going to be judged by God and everybody in the community, versus the medical model. And when I look at my life before I went to school to learn about this, I used to be one of the people who used to judge. Even when I did like the harm reduction at school, I'm like, why can you treat substance with a substance? And finally, getting educated and informed, I now understand alcoholism, substance use disorders are conditions just like diabetes, hypertension, and other conditions. Why do we have empathy for someone who have cancer, and we don't have empathy for someone who is going through substance abuse? And
Yes.
so I think with the sensitization of the community, we need to have health promotion and health education in the community for people to be able to understand. Thank you.
Yeah, we absolutely and even we don't talk. I mean, there's so many substance use programs that exist within our community that use peer-led. I mean, I'll give you an example. I won't name the program, but it's I'm trying to remember the word for it, but it's essentially run by peers. And so they make the decision of who's coming to treatment. They pull each other up and make each other accountable. And so when you think about that model, right, you have really, I used to always, I joke, right, like, because you have to come in and you interview with the whole house, right, and they ask you a bunch of questions. And I used to joke, like, I probably slept with all of your boyfriends, right? Please give me a chance anyways. But the reality is one person cannot like you, right? Or and suddenly you have really sick people making decisions of who is worthy of accessing treatment. Everybody is worthy of accessing treatment, and we should be using a vulnerability scale or a vulnerability index to decide who comes in next. Not we like this person, not chronologically you're on the list. Who is the most vulnerable, and how do we get them to access our services now?
And it's like you say, Nikki, people like some addicts come from trauma. They have trauma in their life, because what I did it because I had trauma in my life, and I try to cover my hurt, my feelings, and numb myself because of my traumas. That's how I started.
Yeah, that's
Numbing
how
myself.
started. And like I said, it's like the fact that we want to treat the conditions separately, though they're so interconnected, is so problematic for so many people.
Yes.
And so when we're talking about trauma-informed policies and programs, so I've talked a lot about the challenges, right? Sorry. I've talked a lot about the challenges, but there are solutions to these problems, right? So
Yes.
I'm going to talk with you about some trauma-informed practices that you can implement within programming that will help. So number one, addressing stigma and promoting MAT. MAT should be the norm, not the exception, right? We should be validating everybody using medicated assisted treatment. And if they decide they want to get off it later, fine. But there's actually a lot of science that says there's actually no benefit to coming off it. The reality is I have a seizure disorder, right? I have epilepsy. Never once has anybody said, go to a meeting and pray your seizures away, Nikki. No, nobody's ever said that. They say, go to your neurologist, take your medication, right? And care for yourself. But with substance use disorder, oftentimes our treatment is actually go to a meeting and pray your condition away, which is super dangerous. And so really, we need to be addressing stigma and promoting medicated assisted treatment within programs. Outcomes improve greatly when people access medication. So
Yes.
we really need to educate communities about the science and benefits of MAT. As I said, I was on Suboxone, right? And I didn't even know how it was working. So not only educating communities, but educating patients, because once you understand why you're doing something, you feel more power over it, right?
Mm-hmm.
And so understanding why I needed that and why, I've always been a huge advocate for Medicaid assisted treatment. And I'm one of the few people that will speak publicly to say I'm on it. It's very frustrating because there's a lot of shame within the 12-step communities around this. You're not really sober if you are on medicine. But I challenge those people. It's like, did you get up and have a cup of coffee today? Did that cigarette make you feel better? Because those are drugs too. So you're not sober either. Go get another 24-hour chip.
Yeah.
So, but the reality is they don't look at those things, right? But it's mind-altering, mood-altering substances that they tell you you have to stay away from. There are so many of them that we come across in our day-to-day. So incorporating that as a trauma-informed practice and treatment programs, and then advocating for policy changes to support access to MAT. And then training providers to deliver MAT with empathy and cultural competence.
Right.
And then just so people understand an overview of MAT. So MAT combines medication with counseling and behavioral therapies. I think it's important to note that it's not like the medication isn't a quick fix, right? You still need counseling, behavioral health therapies. I needed EMDR. People need different paths for everybody. And I always say my path out of prostitution and out of substance use disorder was through social justice work. That is when I found my voice and felt like I had some power in this world and that I could use that to propel me forward. It has proven outcomes that reduce relapse risk. And it's recognized as the gold standard for treating opiate use disorder. Liberation Health, there we go. So let's talk about some strength-based policies that we can implement that actually will help, right? So I think one is like building participant resilience through strength-based interventions. Like I told you earlier, it's about championing people and celebrating the small successes that they've made. Creating flexible, individualized care plans. So I'll tell you, a lot of times in substance use programs, what we do is everybody goes to the same groups. Everybody's required to be in those groups. They're required to be downstairs at 7 a.m. and be in groups all day. And we don't factor in individualized care plans, right? So an individualized care plan isn't you're going to do the same thing as everybody else that comes through this house, right? It's going to be like, oh, maybe you're volunteering, maybe you're seeing your doctor, maybe your children, right? Everybody's different. And oftentimes when we make these individualized care plans that really aren't individualized, you're causing more trauma for people. Like, for example, if you have somebody that just had their child removed in a parenting class, right? That can cause harm. And so not everybody is the same and people need different things. And when I opened Jana's place, one of the things that we did was we gave everybody a schedule, and they had to put 40 hours of productive time in their schedule. And that meant some of the groups, right? That meant seeing their family. That meant going to work. That meant volunteering. That meant a million different things, right? As long as it was productive. And so everybody was able to figure out what they needed and how that worked for them. And then they met with their counselor and they discussed that. And it was actually individualized, right? Using motivational interviewing to foster empowerment. I'm really about strength-based approaches always. And then incorporating culturally responsive and peer-led approaches. Again, we talked about the danger of some of the peer-led work, but there's also really great successes in the peer-led communities as well. And so making sure people have the appropriate support that they need, they have the appropriate training that they need, that they're not projecting their beliefs and values on somebody else, and really having great supervision is so critically important. So we should be building safety and physical and emotional security with people. We should be having trustworthy and transparency, so open communications, peer support. There's importance of lived experiences, collaboration and I can't say that right now, mutuality, equal partnerships. And so, like when I talked about, you know, the counselor sitting in the office behind the door, and then, you know, this real power imbalance sitting across the desk from somebody as they're telling you what you have to do, that is not mutuality and being equal partners, right? So we should be figuring out how to reduce power differentials. Yes, these are the SAMHSA trauma-informed principles. Empowerment, voice and choice, respecting autonomy, and then cultural, historical, and gender responsiveness, addressing identity and systemic factors. So recently there's been like a big push in our area. We have a lot of men's programming, and right now we have very limited women's programming. And so I think that's a gender gap that we need to address. But we also need to address it with appropriate programming, right? So trauma responsive programming. And I also want to say the men's programs, so women's programs and men's programs are set up exactly the same, and there's different needs in both communities, and both communities have to have their needs addressed. And so looking at the programming, how do we undo some of those harmful policies? How do we, yeah, I believe you're correct. She said, in my understanding, we have 0 programs in the area that are queer affirming. And that's so problematic. When we opened Jana's place, again, I'm no longer there, but when we opened, we were one of the only programs that took trans women. And it was so problematic because they were denying trans women access to substance use space. And so how do we shift and make sure that people have access to what they need? For me, it was like creating the space of survivors of prostitution, because women had come in and, you know, they shared their experiences in the programs, and people were really judgmental and negative towards them. Like one example, a survivor went into a program, and every time she worked in a strip club, and every time she took a shower, they would make her bleach out the tub afterwards because they considered her dirty. And so creating space where survivors could feel comfortable sharing their experiences without judgment, because we'd all been there, right? And so it's so incredibly important to make sure we're incorporating trauma-informed principles. Oh, wow, I went way too fast. I'm sorry, we're not going 2 hours, guys. I'm giving you an hour of your day back.
I don't know about that, Nikki. I'm sure people have a lot.
Yeah. Oh, good. Let's have a conversation.
And we, you know, haven't, I know many people are regulars here today, but also I think a lot of people are here because of the Department of Justice report.
Yeah.
And we're very interested in sort of hearing about how many years you've been working to call attention to what's happening to people. And you know, when you and I set this up, I was thinking, like you, mostly about substance use disorder and how we really need to respond differently. But with the timing of it, seeking help, we know the police are like our front line of help seeking, right? Like we're always told, whatever crisis it is, call 911, call the police. And what you've been sounding the alarm on for a really long time, the DOJ validated that the people that are supposed to be helping are victimizing women. Are victimizing women.
Yeah. I mean, my daughter the other day was like, I want to be a police officer. I'm like, we'll work on that. She's 4.
Four.
We'll get there. But you know, it was, so when I first got out of the life, you know, I was very hesitant to work with police or because I have my own traumatic experiences. So I'll kind of explain what we're talking about when you're reading in the justice report, cop checking or counter surveillance. So what happens is you get in the car, right? And you say to the guy that's picked you up, are you a cop? And they say no. And then you say, touch me to prove it, right? And they do. And so we're under the impression that if it's a police officer, they can't touch us, right? The reality is the internal policies at the police department allowed them to do just that. And people were, you know, feeling breasts, feeling genitals, inserting digits. It was really inappropriate stuff. And so we brought this actually to the police department at a public meeting. And we're essentially told, it was the first time I ever had to excuse myself from in a professional capacity because I was so overwhelmed by the conversation. Because here I am thinking what happened to me was wrong. And I have this captain sitting across from me saying, no, you asked for it. That's literally what he said. It's consensual. They asked for it, right? And so I commissioned some research. And we worked with Clark University to do a study about police sexual misconduct. And the study was really alarming. And so I didn't feel comfortable taking that report back to the police because the police already told me that what they're doing is legal and they don't have to stop. And so we took it all over the place. We took it to I took it to other nonprofits because Lyft was so small at the time. I was really nervous to step forward with this report, condemning the police report because of retaliation. I was scared, you know, and to be honest, I'm still scared at times, but it's the reality of what needed to happen. And so we took this report to the DOJ, and it took them a long time to actually take action and open an investigation, but they did. And it was the first time that they had a finding that police violated people's civil rights by the patterns and practices that they were doing, and very specifically to prostituted women. And so it was validating, but you know, it's very frustrating now because a lot of the city responses that we're getting is essentially like, give us the names of the victims. And it's like, you know, we worked with the DOJ, we worked to bridge trust. They brought in experts in gender-based violence to conduct these interviews. And none of us wanted criminal trial. We don't want to go through a criminal trial. I don't want to go through a criminal trial. So like they can do more of the, oh, we can't believe her stuff. It's, you know, I was looking for systemic change. So a question from Sue.
You're muted, Sue. I just want to say Sue is a commissioner for the status of women, and Sue has been right there.
I recently applied for the commission on the status of women.
Beautiful.
Yeah.
I saw you speak, gosh, I had just had to look it up, in 2017, when you came to talk over at the Boys and Girls Club in Worcester. And you were amazing then. And your story since then has gone through so many hurdles that I am just in awe of all you've overcome to do what you do.
Thank you. Yeah, there has been a lot of hurdles.
There has. So thank you.
Yeah.
If
And then
from Worcester and they don't know about the Department of Justice report, it literally came out like a week
yeah,
ago?
it's been a week.
It's been a week. And, you know, one of the challenges we've seen so far is same old, same old. This did not happen. This isn't true. And you know, my soapbox is around trauma. And we know that when people have been harmed, the greatest predictor of whether they could recover or not is how authority responds to what
Yeah.
they've had to say, right? If
Yeah.
you say to people, nope, that didn't happen. These are great guys on the WP. They wouldn't do that. That is 100% the wrong response.
So, a colleague of mine, I don't know if she's on here, Karen Riley McNary, who's done a lot of work in trauma work and intimate partner violence and exploitation. But she said to me, you know, when the police chief spoke to the Telegram, and he essentially said, these guys have wives and children, and they have to go home and explain to their wives. So if you have to go home and explain to your wife that you're not one of those guys, you are one of those guys. She knows best. Like, the fact, it was stunning to me. It was like, wow, because they have wife and children, they couldn't possibly be a perpetrator. The reality is most sex buyers are actually married men.
I thought that was disgusting too.
I
Like,
didn't
no
have,
woman ever is, I mean, some women that are going along with the program of the police can do no wrong, we won't name names, but any other human woman is not shocked that men are doing this. Like, come on, really? And if you are shocked, are you, wake up, wake up. And what do we need to do to believe women? You've been saying this. Like, I came out of the gate like, oh God, I hope that the city manager embraces what's going on and says, this happened, we're making it right. And people have said to me, he's saying he's shocked. He's not shocked. Nikki, you've been saying this for as long as I've known you, which is coming on a decade, I would guess.
Yeah.
You have been saying this. So anybody who says that they are shocked by this report and they don't believe it needs to wake up.
agreed. Anybody else have any questions or?
Bill has his hand up, but I know Bill has direct experience with the police.
Yeah, and that's exactly where I was going with this. Just a couple of minutes ago, Nikki, you were talking about the difference between or trying to figure out if a person was a police officer or not by, you know, letting them touch you, or you touch them, that kind of thing, and being told that that's part of our policy. Well, there's a huge difference between standard operating procedures and policy and state or federal law. Have you ever been able to get anybody to determine that, regardless of what policy they may have set, that that's actually illegal, either through regular law or case law?
So I haven't, well, the DOJ found it violated survivors' civil rights. So that's something, that's a place to start. You know, up until very recently in New York, it was legal for police to have sex with women in custody. So these laws are atrocious and are finally starting to change, but oftentimes they don't even know that these laws are on the books. And so I think starting with violating somebody's civil rights is a great place to start. And they're saying that they no longer engage in this policy. But from when I speak to survivors, I hear very different.
Thank you.
Yeah. Kanisha?
And I appreciate that you're doing what you do. You're so brave to do what you are doing.
Thank
and
you.
You're helping a lot of people, and thank you very much.
Thank you. Kanisha?
Hi, Nikki. It's been a while. It's so good to see you again.
Good
And
to
every
see you
time I
too.
hear you, I just get happy. So, but not always happy about what you're talking about, but happy that you're talking about it. So thank you so much. I have a question for you, and I'm so grateful, Bill. I don't know if you remember me, but it's good to see you again, about something you just said. And I'm interested in policy because, and Amy, she might be laughing or rolling her eyes or both. I'm so done with these systems. I've worked in so many places and I just refuse. I'm like, stick a fork in me, I'm overdone. We're done with that. But it's now like, okay, well, done with that, and then moving on to what? So that's been a large part of my thinking, like, well, what is the next step? One of the steps I think is important is policy. So I've been looking at a lot of the antiquated laws that are on books. And I'm interested in your opinion from, I guess, micro to macro. What does this look like in terms of being able to shift change? I've been thinking about like the ridiculous laws, like, you know, Texas, it's illegal to have a dildo, but you can go get a gun. And I'm like, okay, so I can go kill you, but I can't get myself off. You know, that's a problem.
Yeah.
But I think there's something funny to that and sad. So it's like, well, maybe that should be talked about from the non-humorous, but humorous. And then how do we evoke change from that way? But I'm just not sure. So I'm really interested in what you think from the micro to macro, what can be done.
I
And
think,
thank you again for what you're doing. Seriously, it's beyond, thank you for putting yourself out there so much.
thank you.
Yeah.
So I think we need policy change. We need policy and laws change. So I think we need to work on the micro and the macro. And so, you know, it's so hard as like an entity or an organization, because it's like you get drowned in the direct service work that you don't have time to work on the policy change, right? And so how do we make time for people to participate in policy advocacy and change? One, within, and like paying people as policy advocates, right? Because these laws, they need to change, but we don't fund people to do that. And we don't fund people for prevention work. So we only fund intervention work. So instead of stopping the harm, right? We'll pay for services to treat the harm. Right? And so how do we really shift how we're looking at these social issues? And you know, I don't have an answer for that. I think I do. I love both. I have my feet in both worlds, which I love. The policy advocacy part, and I love direct service and working directly with survivors. And you know, I've been fortunate enough to I had the space to do that, you know, and now we're starting again and should have some good news coming soon. Peggy?
Hi, my name's Peggy. I work at Pathways for Change. I know it was kind of a flippant thing when you mentioned the legalities of dildos in Texas, but just a month or so again, my director was talking about how they were trying to raise the legal age of marriage federally to 16, and how that was a scary thought. And the reason why it's scary is because even though it sounds like it's a great thing, because there's still states where they allow marriage at 12 with parental permission, raising it to 16 is actually still scary, because it needs to be raised to 18, because as great as it sounds to raise the legal age to 16, legally you cannot get divorced until you are 18. So those children who are getting married at 16 years old would not be able to legally divorce abusive spouses or escape a marriage until they are 18. So they would be legally stuck in that marriage until they are 18 for 2 years. So, yeah, with policies and everything, when we look at these policies and get excited for changes, like, oh yeah, this is great. The 12-year-olds won't be able to get married anymore. 16 is awesome. We really have to look deeper in these policy changes to see how that really affects things. And is 16 good, or maybe we should just make it flat out to 18 like Massachusetts is?
Yeah, 16, I agree, 16 even feels abusive. I worked at Pathways for Change too, by the way.
Yeah. But like people see like, oh, 12 years old is bad, so 16 is great.
Yeah.
But
No.
it's like, okay, but no, we want 18.
Yeah.
But it's like people look at other laws, like for example, BDSM is illegal in Massachusetts,
Mhm.
but it's not illegal to get married or do other things.
Yeah.
So
Phoebe?
Hi, I'm Phoebe. I'm from the Worcester County Youth Action Board. And I thought what you were saying about like organizations getting really, really caught up in the direct service work like resonated with me. Because I'm part of the Youth Action Board, like we're an advocacy board. but we have been like really restricted in what we can do. And I'm not faulting like our host organization for this. It's like legally I learned this year that legally nonprofits cannot engage in like policy advocacy. They can't support like certain laws. They can't publicly support certain candidates, which I think is like really like it's kind of telling of what nonprofits are actually for in the system, and like the fact that they can't do that sort of preventative work or that sort of advocacy and are pigeonholed into just direct service and like are told, yeah, just be a band-aid or else you'll lose your funding. Like I think that that's like very very telling. But the second thing that I was going to get into had to do with what you said earlier, that I actually would want to not push back on necessarily, but add a little bit of perspective. I do like what you were talking about, how we needed to prioritize people who are most vulnerable for getting help. And I do understand the value in that. And I partially agree. Like, I don't want to say that that's wrong because I don't know, but just like some food for thought that like, if we want to prevent people from reaching rock bottom, how do we do that if the only services that we have that I understand are not enough? Like there's not enough slots for people that are going through this. They're only prioritizing the people who are most vulnerable and who are at rock bottom. So like, where can we weave in the preventative stuff so that we are helping the people that are most vulnerable, but we're also preventing people from getting to that point and like preventing trauma from happening before it happens. Yeah, that's all I had to say. Thanks.
Yeah, I think the vulnerability index or vulnerability score is an important component, because, you know, what I'm talking about is, okay, if a woman is able to stay at her parents' house while she awaits treatment, and that's a safe environment, that we would prioritize the woman that when she leaves our treatment program is homeless, hungry, and back using substances, right? So I think most programs actually don't use a vulnerability score. They go directly by a chronological list, right? Whoever came first goes first. And I think that's problematic because people are in differing situations. And so I'm not suggesting that if that person is in treatment and, you know, they're about to leave and they have nowhere to go, then they would be prioritized. And I think that's I agree that that's what we need. But I mean, everybody's got a differing opinion on it. I'm not closed off to hearing people's opinions. Oh, Amy, you're on mute.
Oh, I'm on. Okay, good. The fact that we just don't have enough services is really clear, right? Like if we'd like to not even be having this conversation.
Yeah.
Ideally, anybody who wants treatment can access effective treatment,
Yeah.
right? Like the fact that we do have to pick and choose who we're going to help is in and of itself a disgusting problem to have.
Yeah,
It
absolutely.
says so much about our cultural values, right?
Yeah.
Like this whole thing is about who we value and who we don't value, who we care about and who we don't care about. And we all know we don't care about people that are using substances. We don't care about women. We don't care about women that are prostituting. And that is really the deeper problem.
Yeah. Yeah. And I will say a 501c3 can do advocacy on behalf of legislation. They can come forward and say that they support bills. You cannot get involved in candidates, but the federal law requires, you know, the advocacy work to be less than a certain percentage of your budget is what it is. So I will say it's not as cut and dry as if you're a nonprofit, you can't advocate. There are ways to do that. Susan, do you have a question?
I just wanted to comment on exactly what you were just saying about 501c3s and just in general, how we advocate as a community. We're probably all working for nonprofits here. I'm taking a wild guess, if not all, most. there's a couple of things, Nikki, you're absolutely right. As a 501c3, you are required to keep records. You can absolutely educate your politicians. You can hold legislative breakfast, but you have to invite everyone. And you can have can have a moderator. You can raise issues. One of the things that is a real tool that can be used by communities is all volunteer coalitions. So if you belong to an all volunteer coalition, such as the Joint Coalition on Health, there's not many coalitions out there that don't receive money from somebody. Or, we're not a 501c3. We have, made a point of not taking money because we can say and do what our community is telling us. And, we went up against the police departments in North County, and it was really difficult, but none of the nonprofits would stand with us. And so the reason that we were able to at least be heard was because we're all volunteer coalition.
Thank you. Thank you for answering that for folks. And I'm not saying the percentage isn't problematic. It is. We need to be able to speak out for systemic change. If we want to stop some of these problems from happening, that's we keep going down river and pulling the bodies out instead of going up river and seeing who's throwing them in, Does anybody else have any questions or comments?
Do you have any other what would be your thoughts and recommendations about what really, I'm thinking right out of the gate, I would love to see many people in the police department lose their jobs. They need to lose their jobs. But, as somebody who's been concerned about sort of cultural change and cultural reform, we know that this is a culture of people that feel that they're above the law and that they can do whatever they want. And they've had that validated pretty consistently that they can, in fact, do whatever they want and are above the law. And, I feel completely kind of horrified and overwhelmed thinking about what do we do about this problem? Because of course it's so continually traumatizing. Like you said, let's first stop traumatizing people and then think about treatment. But it feels so overwhelming. I don't even know how to do that. And you are one of the only people I know that does not buckle down in the face of enormous obstacles.
Thank you. I think we have to keep pushing, and I think we have to keep pushing back on discrediting this report, right? When you're discrediting this report, what you're essentially saying is, I don't believe survivors, right? I'm actually in a privileged position to be able to come forward and say this happened to me, right? I have the socioeconomic resources. I have a husband that's supportive. I have a community of strong women around me, right? But not everybody's in that position. So when we're doing this, tell us the names, tell us the names. It's really offensive. And so I'm really hoping that people shift away from that and start taking responsibility for their actions.
Agree that the individual narrative it's just some individuals is so much part of the problem and why we're doing macro work here, because this is not about individuals. This is not individual problems. This is a system. This is a system.
Yeah, it's funny, not funny, haha. Ironic, because it's like they want somebody to just name an officer so they can arrest the officer and then this all goes away. And it's like, no, right? This is a systemic problem. We can't address it by arresting an officer. They looked at their own police reports. They said in the police reports they did it. If you want evidence, go look at your police reports. You have the officers' names that are telling you they're doing this.
They have thousands of data points of their data. So it's just such a bunch of hot nonsense to act like that. We're not sure this really happened is denial, is it's just despicable. It's despicable. Barbara Mudd, NAACP, among other things. We'd love to hear what you have to say.
Oh, you're on mute.
But you are muted.
Oh, this has been really just packed with very powerful and moving information. And I thank you. I thank Amy for having you, and I thank you. And I just want to mention that tonight at City Council, Project Priceless is coming forward with a couple petitions, one asking for apology, and others asking for another one asking for reparations, financial and also mental health. And many of you are probably aware of Project Priceless. It's a mutual aid group. Most of these women are unhoused, and many are struggling with addiction and have been trying to exit the sex trade with literally no supports other than the organizing that they're doing amongst themselves. They are the ones who tried to stage the protest last year outside of the shelter, and a very small group of them were met by 30 police officers on the second day. So this has been very helpful in terms of if any of us are able to go tonight and support them. I think the information that you have here is really incredible. So thank you. Any other suggestions for things that could be said tonight or done tonight at City Council?
I think really just supporting like that, stop questioning the women. I think that's important.
Yeah.
You know, I don't know about demanding a public apology. I don't think we're going to get one, unfortunately. And so, you know, I think I love what they're doing with, you know, reparations and wanting actual solutions to this problem, you know, and that may be coming.
Yeah. Yeah. And sad to say the whole issue of, you know, of that you brought up around, you know, like everybody is worthy, and please stop, you know, treating these women as less than human.
Yeah.
And all of these women, as far as what I have had very traumatic experiences with Worcester police.
Oh yeah.
Very.
Yeah, like I came forward, but you know, I think people don't recognize in the report, they focused on from 2018 to 2023. I wasn't even out there then, right? So these things have been happening for decades, if not since the beginning of time, right? So it wasn't just me making, you know, they're kind of trying to say, oh, it's Nikki, she's a noisemaker, right? Like that she's not telling the truth. But the reality is all of those women that spoke to the police, they weren't Nikki. So you don't believe any of them either?
Right. And many of them, did not speak to the police and are really suffering from the trauma, and they're still out there unhoused without any services.
Yep. Lynn?
Yes, thank you for recognizing me. And from what I've heard, this has been an amazing, amazing training. I personally am a survivor of childhood sexual abuse. I personally went through the re-victimization at the hands of the justice system. I did, in fact, get a conviction after 6 years and 2 trials. However, the man has not been held to any of the SORB regulations put down on him. So that's my qualification for why I'm on this call. I'm also a recovering addict. My sister Amanda passed away from an overdose here in the city of Worcester about 2 years ago in January. And I was a year clean when that happened, and I vowed to do something about the fact that she was unable to receive the trauma treatment because she was also raped as a child and also re-victimized by the justice system to the point where America's Most Wanted had to catch her offender after he ran from the courthouse when he was convicted. I refuse to allow that to continue without doing my part to try to change it. And you, Nikki, are an absolute inspiration.
Thank you.
Being said, and I'm only saying this because I just was with her and I asked her if this was okay. So please know that if you know her. But Heather Prunier Stanek, she went through a similar thing as a child 30 years ago. The man who, and I'm not even going to say allegedly, the man who raped her in a Worcester public school for over a year was never put on trial, even though we've now come to find out that there were 40 plus corroborating witnesses.
Wow.
He went on to serve in the public school system, from what I understand, for the next 30 years, was a principal, ended up on the school board, and did not leave that position until Heather started protesting. Heather is not a sex worker. Heather is not an addict. Okay, and it shouldn't matter. It shouldn't matter if we're sex workers, if we're addicts. It shouldn't matter if we're black, white, brown, purple, and polka dotted. Okay, believe women, investigate their cases and do something about it. And if one woman, let's say 10% of those cases are true, is experiencing that, all right? Is that not good enough to do something about it? You're going to say that that 10% is okay when the DOJ has quite literally never found another department that has done this. And so I may sound angry, it's because I am. This is an opportunity. This is an opportunity for those of us in the city of Worcester that have experienced injustice in any arena to take this city back. It starts with this. It starts tonight. All right. So I am not going to say anything. All right. Because I don't live here yet. I operate here. I work here, etc. Okay. I did my using here. My sister died here, like I said. But I don't live here yet. So I'm going to remain silent and let the people of Worcester speak. But I would hope that there is a demand for city council not to vote on the contract of the city manager tonight, one way or the other. Don't even discuss it, put it aside, and to stand up against the continued suppression of the problem at the Worcester PD, to stand up against the way the administration has handled it, however they can. That means voting for things that are in support of transparency and change, all right? And standing against things that are not, that are about maintaining the status quo. And I want to be clear, I don't think that the leadership of this city is intentionally evil, although that's what it appears they are. But that's the problem. They need to be checked. They need to be checked. And this is from a complete and total outsider's perspective, as I just said. So I will go back and watch this, and I'm sure that I will soak it up. I watched the first few minutes, and Nikki, you had me crying because I am so grateful to know not just one in Heather, but now two women who have gone through something similar to me and my sister. I knew you guys existed. I didn't know where. All right. A lot of us are afraid to even talk about that stuff, especially those of us that have been through the bullshit that we've been through. So yeah, for whatever that's worth, I just wanted to, I don't know, claim my seat and let you know that that is my personal opinion from the outside looking in. I will be there tonight, and I cannot wait to see us all come together for change. And that's it.
Thank you. And thank you for sharing that.
No problem. Thank you for being you and for persevering for a decade in support of women like us. Thank you.
Lynn, I so appreciate what you said too, because that is something that people don't seem to understand. The intersection of childhood sexual abuse and addiction, prostitution, all of the, if you are sexually abused as a child, you are set up for this. And that is disgusting. And this is an intersectional issue. And I know Nikki gets that and people here get that, but this is about being in a group that's oppressed. This is about being female. This is about being LGBTQ. This is about being Black, brown, indigenous. This is who does not have power in our culture. And the police are the social norm police. They are here to make sure that you know you're in an oppressed group because of the way you're treated by police. And we have the numbers. And Lynn, when you said that about like, wow, you're now I'm meeting more people, there are so many people. But because of the mechanisms of trauma, they retreat into depression, anxiety, isolation, and don't come out and say, this happened to me. Nikki's turning this around. We are turning this around. People are coming out and saying that this has happened and we're not okay with it. It sure as hell needs to stop happening in the public's name. Not going for it anymore. And we're going to thank you for being there. Everyone who could be there tonight. We're going to go kicking and screaming against this narrative that this isn't true or this isn't happening and that there's nothing we can do about it. I'm done with that bullshit. Chrissy, I'm sure you're right there with us.
Absolutely. And I just wanted to say that it felt like a really good training, and I felt like Nikki is back, and this is the warrior that I'm have always been behind. So it's really nice to see you, Nikki, and good luck with what you're doing tonight and all the work that and you continue to get movements in our favor.
Thank you. Right. So it looks like people are getting a half hour of their day back. Oh wait, nope.
You got one more?
Yes, Kristen.
Kristen.
I'm so sorry. I won't be.
No, you're good.
I just want to tell you, I really appreciate this. I wasn't expecting to be so engrossed, and I'm just really impressed and amazed. I read this report all on my own when it came out. I'm horrified, obviously. I have highlights over the whole thing. So just like a comment, as far as the mental health piece, that's what I was sort of focusing on mainly. I would say that's probably my main like area that I've experience in, but there's a lot of horrifying stuff in here. Um, and I did have an experience over the summer with somebody, a person who was clearly experiencing mental health distress. It's a longer story I won't get into, but it sort of validated when reading this report, validated my feelings during that incident. And so when that happened over the summer, I knew instinctually I didn't want to call the police. They ended up coming, again, longer story, but when I called the crisis unit, one thing I found out, and again, this is probably a longer issue, but they had told me because the person was unhoused, they wouldn't come out for him. Um, and I don't know if that's like a regular policy, but as I'm reading this police report, this DOJ report, it's talking about, well, with many of the cases that they give, but this one in particular, like when the officers are responding to what they know is a behavioral or mental health call, like they know it's in the report that's confirmed. These officers know what they're walking into, and even when they have sent quote unquote trained officers, there's still documented excessive use of force and like unnecessary escalation. So I'm feeling a bit cynical in that sense that we are, we're training people, we're doing these things, we have these programs like this unit, the crisis mobile unit, even the recommended remedial measures under use of force number 5, it talks about coordinate with available resources so that the behavioral health professionals come out, ensure that the WPD deploys officers who are trained. And it's like, they're kind of quote unquote already doing that, but they're not doing that. So I will tell you, I was feeling more cynical after reading this report, like, okay, this is just a bunch of lip service, until I realized here I am listening to all of you and realizing that you're kind of one of the powerhouses behind this. So I commend you for that, because at the end of the day, we have this thing in writing now, and that's a huge accomplishment. And I don't know what to do. I don't know if you even have any like comments on that, but that's something that's like just been, can't stop thinking about a lot of the stuff in this report and just how, like, where do we go from here? But I think this is a great community of people, and I'm really honored to be here. So thank you.
Thank you, Kristen. You know, I am challenged by police even responding to mental health calls. They tend to escalate things, not de-escalate things. And so, you know, there are other cities that have co-responses or they deploy a team of clinicians rather than police. And we had the ability to create that we went through a whole thing with the Mayor's Mental Health Task Force, creating this program, getting data, figuring out what worked. And then we ended up going with the co-response, which I think is super problematic. But, you know, they had their mind made up of what kind of program they were creating before they even gathered us. So it was a huge, futile waste of time. But, you know, hopefully they'll change that. And maybe that's something we can ask for change with now, you know? Because one of the things was they engage in excessive force against people in mental health crisis. And so I think when there's a community meeting tomorrow with the DOJ, I think people should attend if they can. Amy, I don't know if you can share that with folks.
I'll put it on I'll share it on the Worcester Address Childhood Trauma Facebook
Awesome.
page too. It's at the YW
Yeah.
City Council meeting tonight. That meeting on Wednesday. And Kristen, thank you so much for, again, bringing to the table, people with mental illness are absolutely being victimized. And, you know, right there, another intentional, oh, people aren't going to believe them. People are going to discount them. That's what allows them to be abused, right? And we're not going for that anymore. Like, it's not okay to abuse people in need and crisis. We've said that so many times. It's hard enough to ask for help. And Nikki, you know this too. It's hard to see when you need help and to ask for help. And then when you take that step to ask for help and you are met with people that further harm and oppress you, no, that is not okay. We're not having that anymore in this city. If I have anything to say about it, if Nikki has anything to say about it, if Susan has anything, Barbara, Bill, all of us, we're done with this. This is not okay. This is not who we want to be.
Okay, well, I think we're gonna wrap up early. Everybody gets a half hour of their day back. You're welcome. I really appreciated the conversation and the support that I got here. And I put my email in the chat as well. If anybody wants to reach out or has any additional questions, I'm always happy to answer them. And I thank you. And
thank you. Everyone has said it, but you are a true hero. What it takes to come forward, what it takes to do the work you're doing, what it takes to speak truth to power. Many of us know how harmed you get when you speak truth to power, but you're out there doing it anyways. And we hope to lend our voices and support to you as we push the city for change, real change, not lip service, not nonsense, not invalidation, real change. Thank you so much for being you and for the work that you're doing. It's amazing.
thank you. All right. Well, thank you, everybody.
Thank you.
Thanks so much, everyone, for joining us. We appreciate you. You can catch us on the record.
Thank you.
You.
And we've got that little survey in the chat there. If you have a minute to just fill that out for us, it helps Worcester Acts get some operational funds that we need to keep offering this great programming.
Sure.
Thanks so much.